welcome back to VETchat. I'm Kathryn Bell, CEO of the Webinar Vet, and today I am incredibly excited to be joined by a brand new guest, Charlotte Hailstones. Let me tell you a little bit about Charlotte before we get started. Charlotte is a veterinary nurse at Blue Cross Animal Hospital in Grimsby and is committed and passionate about animal welfare. She works closely with rehoming and behaviour, playing a key role in caring for and handling stray animals. Welcome, Charlotte, to VETchat. Thank you so much for joining me today.
Hey, you're welcome. Very excited.
So, as we were just saying before, as part of our Empowering Women series, what we're really trying to do is just highlight women in the profession who come from, lots of diverse roles, lots of different backgrounds, and we really hope that by sharing their experiences that we can raise awareness of challenges that might be being faced, just to educate really and hopefully try and inspire others in the profession. So really, really glad that you can join us today. I'm really looking forward to hearing all about you.
No worries.
So to get us started, do you want to tell me a little bit about your kind of journey into veterinary nursing and what led you to specialising in animal welfare and rehoming?
So I think, like most people in our profession, it's been a lifelong passion. I've always loved animals, even from being tiny. I originally wanted to be a vet, did my work experience, picked my options, expecting to go down that route. And it was after I did my work experience in a vet that actually it made me realise it's not that side of it that I'm interested in. I think I wasn't really sure what the roles were, and it was the nursing side, the caring of the patients pre and post op, and the medical nursing that was the thing that actually piqued my interest. And so changed all my options, changed what I did, and then went down that route. But I've always had an interest in animals. And then I worked originally in the private sector, moved then to the charity sector a couple of years after qualifying. And it was then, because we're quite a large charity hospital, we see a lot of stray animals. So sort of the welfare side of things, rehoming, behaviour, kind of all comes in with the number of stray animals that we see. So we don't rehome from the hospital, but
Okay.
we send a lot of the animals to rehoming. And obviously it's kind of myself and one of my colleagues who do most of that, chatting with the other directorates. So it's kind of been a passion that's been through circumstance rather than something I set out to do, but it's
Yeah,
definitely, a huge passion of mine.
fantastic. And have you been with Blue Cross for long?
Yes, so I've been here 9 years now. So
Wow.
next January will be my 10-year anniversary here.
Oh, congratulations.
Thank you.
And what does a sort of typical day look like for you?
So I'm staff nurse of kennels. So I'm mainly based in kennels. So we come in, we do a staff huddle first thing in the morning. So we kind of know what's happening with the day, who's going to be where, is there anything we all need to be aware of. Before heading to kennels, where we do our morning ward rounds, get the handover from the night team. Obviously, it's a general day in kennels, so obviously medicating the patients, bloods and fluids, monitoring as they come around from anaesthetics, discharging them to owners. Obviously, a lot of our discharges can be more complicated ones, so doing a lot of that patient care updates with owners, getting them in to visit their pets, just the general nursing, day-to-day nursing before handing over to the night team again in the evening.
Mm-hmm. Okay, brilliant. So very busy.
Yes.
And have you noticed a lot of change over the last 9 years in terms of just how sort of busy it is, what you're sort of seeing, etc.?
I think there's been ebbs and flows, as there always is. COVID obviously has hugely impacted the way we work. So we've started doing a lot of remote consults, remote checkups and things. So that's obviously changed hugely, because I could never have imagined doing a remote consult before, when I first qualified. So things have changed. I think there are always those, ebbs and flows with how busy we are, depending on what's going on and obviously staffing levels. But it changes all the time.
Yeah, absolutely. Yeah, we were the same. We were before COVID, we were like in the office like every single day, at the Webinar Vet, whereas now we have much more of a kind of hybrid type setup.
Yeah.
But
Yeah.
before that happened, you just wouldn't have even like thought that you could
No.
work like that.
No, not in our profession. Yeah.
Yeah, absolutely. So obviously being a vet nurse, the profession, I think the last stats I saw, veterinary nursing is I think 98% women
Yeah.
in the
I'm
profession.
not surprised with that. Yeah.
Yeah, yet there are still many sort of challenges that women in the profession face. Have you had any sort of experiences that you'd like to share around, being a woman in the field?
So I think the biggest thing that affected me personally was, having a child. So my little girl's 4.5, and I was staff nurse of kennels before I fell pregnant. And it kind of dawned on me sort of around 20 weeks, being 20 weeks pregnant, that I thought, oh, it's not a guarantee that I'm going to come back into my role. It was a full-time role being staff nurse of kennels. I'd joined the Blue Cross as well for that career progression because it's such a large hospital. And it kind of dawned on me that actually having a child was potentially going to change my career. And it was not something I wanted to happen. I didn't want to go back to just standard nursing. My passion does lie with the medical nursing and that side of things in kennels. Luckily, my work have been very supportive, and we was able to do a job share, like working around that, so that I've been able to retain my staff nurse position, but also have employed then another staff nurse. So hopefully if it's her time to have children one day, she's got that flexibility as well. But it wasn't a guarantee, and it was something that we had to have long discussions over how it would work, because obviously it's not just what was right for me, but it was what was right for the hospital and the charity as well. But I think the hours that we work, obviously they're not always flexible. You do miss out on, those, as I'm very lucky that I've got a very supportive family and a husband who can share of that childcare, but it's not easy. Despite that, you want to be there for your child, you want to pick them up from school, drop them off to nursery, and the hours that we work, and the nature, you can't just leave when it's your home time. If you're mid procedure, you can't just go. I think there is still that sort of maybe a little bit of a lack of respect with the profession, especially the nurses. I think a lot of clients, can sometimes still see you as a younger female. And does that mean that, do you know what you're doing? Is there that same respect there if you had potentially a male colleague doing the same role? So I think I've probably experienced that, that gender bias as well in the role. On occasion, someone's
Yeah.
preferred to listen to a male colleague over myself,
Oh, really?
which can be difficult. Yeah.
Yeah. And with that example in particular, like, how do you kind of navigate that?
So I think with I think you've just got to be, sure of yourself, and
Yeah.
carry on with, your professionalism, and show actually that you do know what you're talking about. And it's just having that confidence in yourself to not be shaken by those experiences, or to feel like you can't carry on and have that conversation. I know I am a professional woman, and I know what I'm talking about. I've done the job for a long time, and that, I shouldn't be made to feel like this isn't a deserved position for me to be in just because I am a female.
Yeah, absolutely. And you touched upon there as well, obviously having your little girl 4 years ago, did you
Yeah,
say?
yeah,
Yeah, 4 years ago. How was that? How did you find like coming back to work after maternity? Did you take some maternity leave and then kind of
yes,
come back? Yeah.
yeah, yeah. I was very, very lucky to take quite a good maternity leave. Coming back to work, I think initially I could have felt like I could never go back to work. When you're at
Mm,
home and you can't imagine, how am I going to fit work around everything that I'm doing now? And
yeah.
actually coming back to work was amazing. It was the therapy that I probably needed. It was adult conversation, able to use my brain, to
Yeah.
have a lunch break to myself. So actually coming back to work was, I felt like I was saying that was my break in the week, actually, rather than being at home.
Yeah.
But it was incredibly difficult. I spent a long time away. It was also kind of overlapping COVID. So I spent the last half of my pregnancy working from home, and then had another more than a year off. So coming back in, so much had changed, names of drugs, what were we using, like local procedures. And it's quite daunting to come back into that world and think,
Yeah.
can I remember how to do that? You know,
Yeah. The plus side, I guess, is you get to have a hot tea or coffee that you can
yeah,
drink with two hands.
absolutely.
Yeah.
Yeah, yeah.
It was funny. I was actually chatting to my friend yesterday, and she's going back to work literally in about a week's time
Hmm.
after having a year off. And she's kind of feeling all the things that you just said then.
Yeah,
She's looking forward to like using her brain a little bit and not
yeah,
just talking like baby talk and things like that. But equally is like, how on earth is she going to balance it?
yeah,
I was exactly the same when I've got two little girls, and I was exactly the same when I went back to work. It's kind of a bit overwhelming, isn't it? But
yeah,
the more you get used to it, it just becomes the new normal.
yeah,
Yeah.
exactly. Yeah.
So do you think that the veterinary profession is improving in terms of gender equality, or do you still feel like there are a few gaps that we need to face?
My perception of it maybe is slightly skewed because at the Blue Cross, at the hospital I work in, and across the charity, there are a lot of, female leaders, so women in management positions, so that there is that career progression. You can see that, female-led work team, which is obviously really nice. But
Mhm.
I think maybe being charity, maybe it's a bit more led that way.
Okay.
Whereas I think maybe the private sector's still got a bit of that gender bias. Maybe a lot of practice owners tend to probably be men, as far as I'm aware. I think it's still skewed when it comes to that. Often the woman is the primary caregiver if you have children, and children do seem to halt that career progression or just make it hard to be in those leadership roles that tend to be, you have to be available at all times. Whereas obviously when you've got children, sometimes you can't always be that flexible. So I think,
Mhm.
in the private sector world, from what I can see, maybe there's a bit more of that. But I think I'm very lucky where I work that, yeah, there's a lot of women in leadership roles.
Yeah, brilliant. That's great. 'Cause, I think what I've kind of taken from a lot of these conversations with people as part of this series, it's very much, you can't be what you can't see. So the fact that you can see that, is fantastic.
Yeah, definitely.
Excellent. And then is there any sort of challenges that you think women face directly relating to like nursing?
I think with obviously, nursing being female dominated, often in the hospital, we are the one dealing with a lot of that emotional burden of caring for the pet and conversing
Mm,
with the owners, often the ones that are there to, help them through tough decisions and,
yeah.
after their pets have been put to sleep. So I think there's a big emotional toll on nurses who have potentially already, like say, got a lot going on at home with their own family and taking care of everybody and everything. I know mental health problems are on the rise in the profession, not just the profession, but across the country. And I
Mhm.
think we do take for granted sometimes that it's a very emotionally taxing job. There's a lot of compassion fatigue and burnout, and that it can be hard to switch off from that at the end of the day. So I think the nurses do bear, but the vets do as well. We all do in this profession bear the brunt of that, burnout and that
Mm.
emotional fatigue. But I think the nurses really do kind of really, really get close to their patients and their owners, and it can be very difficult sometimes.
Yeah, absolutely. It's an interesting one. We've actually, at the Webinar Vet, we've just launched our Wellbeing Hub
Hmm.
because we've been getting so much feedback from our community that things are just feel really heavy at the moment
Yeah,
more than ever, which is completely what you were just saying. So the idea with the kind of hub is that everybody can go and access free support materials, whether it's podcasts or webinars or blogs or
yeah,
whatever it might be, just to try and help with that. Because yeah, I agree completely with what you were saying. We are getting a lot of that from our community as well at the moment, which is what they really want support with.
yeah. That sounds great.
Yeah. Okay, wonderful. Thank you. In terms of if there are any kind of women at the moment who are looking at entering the profession, so a little bit like you were way back when you kind of changed from being the vet to the nurse, is there any sort of advice that you would give them?
I think it's, remembering that I've always looked at work as I absolutely adore my job. It is my passion, it's a vocation I've trained to do. But I see my life as I work to live, not the other way
Mhm.
around. No matter how much I love my job, I've got so much more on the outside of work that gives me that drive, and that yes, I'll work my hardest when I'm here, but when I
Mhm.
leave, that's done and I've got so many other things to focus on. I think this profession can kind of scoop you up and spit you out a little bit. So it's kind of making sure that you've got that good balance of a good work life and a good home life, so
Mhm.
that and that can help in the future. It can definitely prolong, I know a lot of people, the retention in the profession can be quite low, and I think it's be prepared for that you need to have that good balance. It can't Work can't just be everything, no matter how passionate you are about it. but also
Mm,
just be curious, because our profession changes all the time. There's a lot of people that maybe sometimes find it difficult to change, and actually you've got to be open to that change, because
mm,
that's how we're going to move forward and progress. So be curious, but keep an open mind at all times. And yeah, the work-life balance is so important.
yeah. I was going to actually ask you about work life balance because it's one of those phrases, isn't it? Like, is it even possible? Like, is it possible to have work life? Is it possible to balance it? How do you kind of manage that personally? Obviously, with all the kind of emotional demands of the job, plus your home life with your little girl, etc. How do you kind of like best manage that?
I've been very lucky to, go part time after coming back
Hmm.
having a little one, which of course does help. I'm here less than I was before. I
Yeah.
think I have always managed to find that work life balance very easily, but I also not so naive to think that everyone can have that. Again, I am so lucky that my outside life, I've got very supportive family and friends, people
Yeah.
who I can talk to about work, and that I am very much an open book, and that if I have a worry or a concern, I will share it with my teammates, with my managers, who are always there to help and listen, and that can help. But I've also got a lot of outside interests. So I love cooking. I find, chopping vegetables very therapeutic. I love exercising more for the, just being outside in the fresh air and having a podcast, listening to a podcast,
Mhm.
just to turn off from the world and focus on yourself. I think it's important to have those outside passions and outside interests to have that work life balance, so that it's not, when you leave, there's always going to be those cases that when you leave work, you sometimes take home, but you have got to try and leave work at the door until you're
Yeah.
next there the next day, and focus on everything else that's good in your life outside of work.
Yeah, absolutely. Okay, brilliant. Are there anything that you think as a profession we could do better to support women? I know that's a very big question, but anything that kind of like comes to mind that you think, it'd be great if we had this support, or X or Y support?
I think because we are female dominated, a lot of us have children or want to have families. I think we need to ensure that there is that still option for career progression
Mhm.
despite having children, that just because you work part time, just because you have children, shouldn't mean that you can't access those, jobs. Like, say, I've been very lucky to do a job share. It's worked out great, but it means that my career hasn't just halted. I still get to do something I'm very good at and benefits the animals and the place I work, while still having that part-time role. So I think job shares, encouraging that career progression, more flexible policies for parental leave, can all help hugely, because I think a lot of people do leave the profession once they've had children, because they just can't continue doing those hours and on calls and weekends and things
Yeah.
while you have a family. Of course, the pay gap, I think, is still there. I think we need to encourage, obviously, for women to be paid, what we deserve, and the same as our male counterparts as well.
Mm.
And the respect as well, probably, as I mentioned before. Female colleagues sometimes don't have that same respect from the general public as the male counterparts. Males are often seen as the surgeons and the vets, and the nurses are kind of, it feels like we're, downgraded to certain roles, but it's not a downgrade. We are,
Mm.
like I say, professionals. We're very good at our jobs. We're just as valuable as the surgeons, male and female.
Absolutely. Preach.
Yeah.
um, we're just running out of time, but I just wanted to ask you as well. I know we've talked a lot about, the importance of being able to see role models and people that you can look up to and things like that. Is there anybody that has inspired you in your career so far?
I think it's so hard to kind of pinpoint certain people, because I am inspired every day by, the colleagues I currently work with. We've got an amazing nursing team here with so many nurses who specialize in different areas and who are so knowledgeable. And, there's always those gaps in your own knowledge, but are filled by other people. And there's always something to learn from. I feel like, as silly as saying something like David Attenborough when I was younger, definitely inspired me for that love of animals, all great and small, from being young, watching his programs and all those animal documentaries and vet programs. But my clinical coach inspired me. She was absolutely fantastic, the passion for the job, and she gave her all. The animals under her care got the best. But yeah, the colleagues I work for, the charity I work for, the Blue Cross, what we do, and the people and pets that we help, but also different initiatives like you mentioned, like I don't know if you've heard of the International Society of Feline Medicine and their cat friendly, clinic scheme, things like that, that are really championing welfare of cats and the dog versions of them as well, just to really, it's the things that I'm passionate about have encouraged me to try and share those ideas in the practice that I work in.
Fantastic. Oh, that's great. Thank you so much. Just finally, is there any one piece of advice or anything you want to leave our listeners with today that we've not managed to touch upon so far?
Um, I think probably nothing new what I've said, but just kind of going back to being, be curious, be creative, and always have an open mind, because this profession changes all the time.
Absolutely. Oh, that's great. Thank you so much for
You're welcome.
joining us today. I really enjoyed listening all about your story.
Yeah, thank you.
And best of luck with everything that you continue to do.
Thank you. And you too. Yeah, thank
Thanks
you.
very much. Speak to you soon.
All right, bye.
Bye.
Bye.